Thanks for having me today. Friends, my name is Dr. Lisa Enno. I'm a board-certified general pediatrician, and I'm the Chief Medical Officer of XpertCare Incorporated. We are a pediatric telemedicine company. We only do telemedicine, and right now we are focused on pediatric virtual urgent care as a way to augment the pediatric actual medical home, okay? So let's go through. I'm sure a number of you have kids. Raise your hands if you have kids. Raise your hands if you have grandkids. Yes, I see you, Raj. And so PEDS hasn't changed in a pretty long time. The same clinic model presents the same problems. So Monday through Friday, closed on weekends and holidays. Appointments are available only during certain times, working hours, limited number of appointments per provider per day. And in my practice as a general pediatrician, I would see the same concerns showing up over and over again. Barriers to care, and you can read them right there. Appointment availability, transportation, childcare, parent concerns about what their kids are picking up in the waiting area. I mean, there's a lot of issues. So what do parents do to get around these issues? In my patient population, oops, keep going, guys, keep going. Why is it not advancing? There we go. What my patient population typically would do is go to the emergency room, okay? It's there, it's available, it's what you can do when you can't get into clinic, all right? And it's a bad idea on so many different fronts, okay? 97% of pediatric ER visits are what we call treat and street. Does not result in an admission to the hospital, okay? We know from the literature about greater than 30% of antibiotic prescriptions from the ER are not necessary. Common PEDS complaints can result in unnecessary imaging. And the one that immediately comes to mind is belly pain that's related to constipation. Okay, no reason you need an x-ray for that, but you're gonna get one if you go to the ER. Okay, and quality of pediatric care for non-emergency concerns varies widely from ER to ER, depending on the comfort level of that provider with non-emergency pediatric concerns and things along that line, okay? Okay, so what are we gonna do about this? It's a mess. Telemedicine is the solution to this, okay? Low acuity, non-emergency pediatric acute concerns can be handled very easily in the comfort of a child's own home, okay? This eliminates so many concerns, barriers to getting those parents' questions answered, okay? If you're being seen at home, we eliminate the chance of that child picking up or spreading an infectious disease in that pediatrician's waiting room, all right? Transportation and childcare are no longer barriers to getting these questions answered or getting these concerns addressed. I've found in my practice that telemedicine actually really improves communication between a family and a pediatrician. Those of you who've dealt with patients in a clinical setting, how many times has a patient said to you or their caregiver said to you, they're on a medicine, I don't know what it's called, it's pink, it's in a bottle. That happens a lot in peds. Telemedicine, they can walk down the hallway, grab it out of the cabinet and show me exactly what it is, all right? And with our particular service, age-appropriate care is provided by board-certified pediatricians, all right? Which is a huge deal, okay? Now, this is the landing page for XpertCare. If you typed in expertcare.online, this is our homepage. I circled it in yellow for you there, right there. Button, click here to schedule your video visit, all right? Our goal is to make sure appropriate care is available wherever families need it, whenever families need it, okay? They Google us, they click on there to schedule their visit. Okay, they can select a provider, and then they can select a time that's available that works for them. Okay, after answering a number of just general intake questions, they get a confirmation email. I circled that in yellow for you. Your appointment has been scheduled. They tell you who it's with and what time, and they even have a little button right there in the actual confirmation email to log into that portal for that virtual visit. Okay, and the thing with our model for healthcare delivery is this: it's so much more than customer satisfaction. Okay, that's actually a picture of me with one of my patients, Dr. Aurora, and I'm still in close contact with that family today. They're such a fun family. We are going beyond customer satisfaction with this service, okay? The idea is that if we can shift low acuity, non-emergency concerns to virtual urgent care, we can trigger a number of positive benefits downstream from that shift, okay? If we take all of the non-emergency things, think of the diaper rashes, general questions about development and feeding, things like that, so many appointments would be made available within that primary care provider's clinic. It increases the chance that a child will see their primary care provider for well visits or other things that need to be face-to-face. This will assist in fostering a strong relationship between that PCM and the family, which ideally will increase compliance with well visits and routine follow-ups for chronic health problems. The one that always comes to mind for me is asthma follow-up. And we all know that preventative medicine is significantly less expensive than acute interventions, okay? So hopefully if we switch low acuity non-emergency stuff to virtual peds, we can foster the relationship between those general pediatricians and their patients and improve opportunities for that prev med, okay? And what I really beyond that want to see is decreased use of ER for non-emergency concerns, okay? Those of you who are clinical practitioners know that the ER is a bad place to deliver primary care, okay? Supported over and over in the literature, okay? If we decrease use of the ER for non-emergency concerns, we can increase chances that the eval and management of that child's acute concern will be standard of care for pediatrics. And we can decrease the chance that that child will be exposed to unnecessary labs, rads, or meds, and decrease the chance of unnecessary healthcare spending and morbidity that's associated with those unnecessary interventions, okay? I could go on and on and on about what benefits this service offers. I'm a true telemedicine evangelist, okay? And I will tell you, telemedicine stands poised to improve quality of life while driving down healthcare spending. At this point in time, honestly, we can't afford not to take advantage of it, okay? And here's a picture of our XpertCare family, just a few of the people that work with us at XpertCare. We're a fun group and we're excited about what we do. So thanks for giving me an opportunity just to talk a little bit about what we do, and I'd be delighted to answer any questions people have about what we do at XpertCare.